Okay, I think we're recording. Okay, so here we go. Tammy, thanks for joining us. Is that Tammy? I don't know if that's Tammy. I think it is or not. Okay, so today I am going to be talking about joint cracking or popping. And so, like, kind of what it is and some different definitions, because kind of like you were just talking about, Lauren, like one of the main problems is you can Google joint cracking or popping, and like a lot of those like buzzwords come up, like arthritis and things like that, and you don't really know what you're finding. So I'm going to go into some of the definitions to start, because I think they get all kind of grouped together, especially when you just Google it. And then what's happening, and then if it's bad. So here we go, at least based on what they know thus far. Okay, so so just as a background, I'm not going to change what I'm saying because joint cracking and popping is like what we all know it as. But in terms of in the research, that's not actually what's happening. It's like a joint release is what they call it. What we would consider a joint cracking or popping is a release, because it is releasing. We'll get into all of that. But so a joint crack technically, or like is really a breaking noise. So like actually breaking a bone. A joint pop is really something like tearing a ligament. So tearing an ACL, that kind of stuff is what would be a pop. So a joint release is when you're going, is a physiologic event when you're going positioned past the physiologic barrier. So say I was gonna like crack my knuckles. So the physiologic barrier is like I get to here and I start to feel some resistance. And then if I wanted, I just of course cracked them not long ago, but if I wanted to crack, I would have to push farther. I'd push past that initial like barrier that you feel. And that's not going past the anatomic barrier, which is where you would actually injure yourself. So you're just going past the initial resistance essentially. And that's where you get that response, and it causes like a functional change. So you get more range of motion, you get relief of pain if you have it. So it may or may not be accompanied by sound. So like in PT school, you learn these different ways to do manipulations to cause a crack, because it helps decrease muscle guarding. So it helps get people out of pain, but they do teach us, you do this quick stretch of the joint and you're going to get that release or that response, regardless of whether there's a crack or not. So you're still going to get a positive response in terms of like decreasing of muscle guarding with that quick stretch, even if you don't get the sound, which I'll kind of get into more in a second. So crepitus is really the one that's associated. Oh, here, admit it does pop up. Okay. Crepitus is really the one that's associated with arthritis. And so like when I search joint cracking and popping, it comes up and it's talking about crepitus, but it's using the words cracking and popping. So I think that's where there's a lot of like confusion. So crepitus is really like, if you were to ever, I don't know if anyone else has done this, but if you put your hand on like your grandmother's knee or something and it's bone on bone and you can feel when they go to stand, that is crepitus. It's like a really like a grady, grinding feeling, and it's friction between either bone and cartilage or bone and bone. So that's like a true arthritis crack. Some people consider cracking, but it's really like a crepitus feeling. And so then tendinous clicks too, I think sometimes people think is the same thing as like a popping, but so that's when it happens a lot in the shoulders and the hips, because both areas have a lot of mobility and not as much stability. So the tendons of the muscles are popping over the bones, like a bony prominence, and that creates like a click. Or if you're like trying to lay on your back and do a core exercise and you move your legs down or around and you feel like a click in your hips is very common. Same idea, the tendon is popping over the bone there, normally because trying to do something that's pretty challenging and there's not enough stability to really do it without that tendon having to pop over. Sometimes it's just people's anatomy, but just wanted to go into that first. So we're really going to be talking about this whole presentation, the joint release, which we will be saying is cracking and popping, but I felt the need to go into this first. So all of the research that I found was done for the MCP joint for cracking, but I just wanted to talk like broadly about joints because it really relates to all of them. But I didn't want to just go into that one. So joints are where two bones come together. So at each end of the bone, it's covered in cartilage, which is kind of like this protective, where's my cursor? This protective covering over the edge. And so that's over time when people do get arthritis, it's that cartilage that really breaks down. And then there's like no longer a cushioning almost, and how it can end up with the bone on the bone. But and then around the outside of the joint, there is this joint capsule. So it creates a vacuum seal in the joint, which is really effective for creating stability in itself. So that's why, like, if you've had surgery before, like anywhere, pretty much, you're not going to have, Molly's got a squeaky toy, so if you hear that, I apologize. If you have surgery, you're likely not going to have the exact same stability you had before. If they're fixing things and replacing it, then you may have something different altogether, but that vacuum seal is never going to be the same again. Sometimes they even take out the joint capsule when they go in there, which is interesting. And so then inside that capsule here is synovial fluid. So this lubricates the joint. You can have more fluid depending, hi Tammy, you can have more fluid depending on what time of day it is. So sometimes, especially with arthritis and things like that, at first when you get up, there's not as much of it, and once the joints start moving, and that's how they kind of get lubricated, and there can actually be more fluid later in the day. Ooh. And so this is actually the MCP joint. But so then outside of a joint, and like, again, I'm just kind of trying to do broad overviews, but there's other stabilizing structures. So there's muscles, tendons, which attach the muscles to the bone, and then ligaments, which attach bone to bone. So they go all around the outside of the joint, depending which one we're talking about. And they also create stability. So we're really innately made for all kinds of stability with all the different structures. So what is happening when a joint is releasing or cracking? So I spent a lot of time looking at the research. And so there are a lot more recent studies on whether or not you're going to get arthritis or what stuff's going to happen if the joint cracks, but not like literally on a physiological level, what's happening. This was the best study, and it was done in 1970. And this was the piece of equipment they used. So I felt the need to include it because.
What is that, a calculator?
Yeah, it looks very barbaric. So actually, it was quite complex, but yeah, I thought it was funny. So, and so they, in this study, which is kind of, I'm going to talk about mostly, what they did was they looked at people, they didn't know if their joints were going to crack or not. And they did the same process of like pulling their fingers and moving them different ways, and assessed what happened at the joint. So what they found, and so what's happening when you get that release is, so it's kind of like I said earlier, so you get that tension applied to the joints, you're going past that kind of initial barrier and getting farther. I wish I hadn't just cracked my knuckles. Let's see. Yeah, so you're getting just a little bit further. And so the cavitation occurs, which is when there's a formation of gas bubble that goes, so once you stretch it past that point, the gas bubble forms and it goes into the joint. So in this picture here, I thought this was really cool. So this is a joint on the left that has not been cracked. This is a joint that the joint was just cracked. So this bubble comes in and it creates more space in the joint. And so this is, and these next couple of steps happen in like literally like a nanosecond. So this bubble comes in and it's in the joint here. And then, but now it has an unstable condition. So the pressure within the bubble is very low, but the surrounding pressure is higher. So that results in that bubble then getting crushed or collapses. And consequently, the energy is released from that bubble, and that's what creates the noise. So it's all kind of, there was like a big back and forth, like, is it the bubble forming that makes the noise or the bubble releasing? But it all happens so close together. They haven't like, they think it's the bubble releasing, but it all happens just so close together because of that like kind of maximal stretching. But yeah, I thought that part was cool. So in this study, so I was much more sophisticated this time. So I color coordinated. This blue is these people whose joints cracked, and the green are the people whose joints did not crack. So this is comparing the amount of space in their joint before and after a crack. So essentially, the people whose joints cracked had a lot less space in their joint to begin with. So these are ratios here. And so the 1 to 2, these are essentially, they're just all you really need to know is there's smaller spaces in the joint. And so after the crack, it gets to a lot more joint space with these higher numbers here. And so what's interesting is these people whose fingers did not crack, down here, these numbers are really not that far from the final for the people whose joints cracked. So their joints were already resting at about the same amount of space that the people get after a crack. So these people already have that much space, and so they didn't get a crack, so the after is the same essentially, but they already have more space. So this article, and nothing I found went into like why people have more or less space. I have some personal theories. And I think a lot of it can be, Tammy's looking at me like, yeah, go on. I really think a lot of it can be genetic. I do think you can train your body while your bones are forming. I think if people are, because Jonathan and I are kind of examples of that. If you start cracking at a young age, I think you kind of train your body because you're still forming your bones and everything. I do think that probably has an effect. That's not shown anywhere. At keeping that space like a little bit less, because it's never, body's always able to get more space almost. But I have to think that some of it's genetic, because it's just like there's such a big difference in the amount of space in the joint to start. But they did not say. Or maybe, they just have big hands or something. I don't know. Well, that's genetic too. Okay. So that's that part. And so this correlates with the other colors. So these are the people whose joints cracked. So here is on this graph, this is pretty cool actually. So this is when they're starting to increase the pressure in the joint, these little X's. And so there's not much, as you can see, like this other side, there's not much separation in the joint happening. So it's almost like, okay, not much is happening. And then this is where the crack happens. And then the separation in that joint exponentially increases. And then it ends up with a lot more space. So the same exact thing is happening here in a non-cracking joint. So they're producing the same amount of pressure or like load to get to this 10, but it's increasing at just a normal amount of, the separation is increasing at a normal rate, and there's no crack needed. So here it barely increases. It has to crack. So if you want to get, and those people whose joints are cracking, if they want to get to that motion, they have to get a crack essentially to get to that end range. And then what's interesting is after they get it, it's not like the pressure just goes right back down. It stays up. So then this top line here is the way the amount of space that stays in that joint afterwards. So it stays at a spot that's very similar to these non-crackers up here. Non-crackers sounded weird. So that end up with this extra space that lasts. So it's not like an immediate, it goes right back to where it was. So do you guys have any questions about that? Oops.
So you're either born in sport mode or you have to get yourself in sport mode by cracking.
I don't know about that.
Kind of.
Sport mode. It doesn't say anywhere like what's better or worse.
That's what I was asking. Like, is it better to have more space or less? It seems like it's like a evolutionary thing. And
yeah, it doesn't. So it doesn't really go into it that much, or it doesn't really go into it. But the thing, some of the articles talked about it as like an inability to crack is because like the muscles aren't strong enough to bring the joints together. But I don't know, that wasn't like a research thing. So these people have more space in their joint to begin with. So if that's the end goal, if that's how you get through your motion, I don't think either is better necessarily. One just requires a fun sound, which I would probably prefer, but because it's, you're ending up at the same place. So there's not a right answer, I don't think, or it's not been shown, but it's essentially like two ways of getting to the same location, getting that increase in joint space. So
I feel like when you get a crack, it lets you know like, all right, I did it. Now I can go about doing my workout or walking around, because I have to, like, if I get up and I crack my hips or my back a little bit, I'm like, all right, I'm ready, let's go. But if I don't hear a crack, I'm like, I didn't get it,
Yeah. And so a lot of times what I see, especially in the clinic, is if people have a lot of muscle guarding or things are really tight around it, that can prevent that crack. So especially people that are crackers, they're used to being able to get that release. And so if things are upset around the area and tight, then that can prevent you from being able to get that release. So that can end up causing pain for people because they're just kind of really used to being able to get that. I will say that, like, in general, it's better to have more joint space. Like, that's kind of an overarching thing, but like, for example, hip arthritis. So like, you want there to be space between the femur and the acetabulum. Otherwise, things are going to be compressing a lot more. And then over time, you end up with arthritis and you need a new hip. So like, a lot of the times the treatment I do for those patients is I'm stretching that joint capsule myself. So I'm really like doing manual work to increase the space in the joint. or I'm sending them home with like a super thick band so they can do it themselves. So our goal is to increase the joint space. So to decrease the pressure that they're feeling. So maybe if they were born crackers, they could have done that themselves. I don't know. There's no way to know, I suppose. But in general, you want more joint space because less pressure on the structures between it. That didn't really answer the question because there's not a, yeah. Yes, Tammy? Wait, I can't hear you. Oops. Did you?
Okay. I was always told as a child that if you crack your knuckles, you're going to have big knuckles and you're going to get arthritis in them.
Yes.
So now you're saying that that is not correct.
Well, don't try to spoil my presentation, Tammy. We are going to get there. But
crack my knuckles.
Yeah, just get to it. Make up for lost time. No,
I would like to add, I was told the same thing, except for about picking my nose and then it would get bigger. So if you could please address that as well, I would appreciate it.
Jesse, I am recording this. I don't know if anyone's going to watch it, but you know. That's my husband, Tammy. I don't think you've ever met him, but
hi, Jesse. I know lots about you.
Nice to meet you.
You should be scared. Okay. So yes, I will get to that, but yeah, okay. Not too far, don't worry. Okay, so this just goes into kind of like I was trying to do the demo earlier and I wanted my knuckles to crack and they couldn't. But so when that cavitation happened or the bubble gets crushed, the gas goes out and it gets reabsorbed in the area. And so that essentially, because of that, the space stays the same, which is higher in that joint for about 15 minutes after the crack, post crack, if you will. And so you can't actually facilitate another crack until that space gets back down to what it was before. Because in order to get it to crack, you have to be able to take it to that end range position. And when there is enough space, you can't get to that, which is where those normal crackers, like, so essentially when you go to crack and you can't, that's how the non-crackers live their lives. Some philosophical stuff right there. Okay. Lauren, you're like, yeah, it's sad.
I was like, oh. I see it all the way.
Yeah, that could have probably gotten more for the slide, but I ran out of time. So what benefits do you get from the release? So really decreased muscle guarding is what we learn in school. And that definitely does happen. People get decreased pain. A lot of people that feel like they have to crack their knuckles, like a pressure that builds up that then is dissipated. But there was not a lot of, I didn't spend a lot of time researching this part of it. I was more the arthritis part. So will I get arthritis? Here we are. So no, is based on, I will say they could do a better job studying this, but I did find a good amount of studies. And then like more recently, it's been a lot, they do a lot of like retrospective studies. So they look back on a group of people. So first one was like 300 people were studied over the age of 45. And then they asked them if they were habitual knuckle crackers or not, because you know if you are, if you're not. And so then they looked under an x-ray and they looked to see if they had the comparison of arthritis. So there was no increase in arthritis in the crackers versus the non-crackers. They did find in the study that the habitual knuckle crackers did have some increased hand swelling and decreased grip strength. So this article was saying potentially there's a decrease in hand function over time because of this. There wasn't much to that. It was just kind of a hypothesis, but that is what they found. But there was not an increase in arthritis. And so then another study, they looked at 28 people retrospectively. They did the radiographs again, so the x-rays. And so, sorry, I can't read my full sentence here. Knuckle popping did not correlate with OA, so arthritis. In fact, well, there was 28 people, but it was like only one of the 15 people who cracked their knuckles had arthritis and like 5 of the other 25 that didn't have it. So it was not correlated with the cracking. And I want to skip ahead to the study 4 because this guy is my favorite, and then I'll go back to 3. So a single physician decided he was going to do this study, and he cracked only one of his hands for 50 years. So just cracked his left hand twice a day for 50 years. And he did radiographs of both hands. and there was no arthritis in either hand, and there were no difference between the hands, which the self-control of that man, I just can't imagine, but I thought that was very interesting. And then the study, the other one, this third one I have on here. So they looked at 215 people, and they actually looked at all the different joints. So like this one, and this one. And they compared crack years, which I think is hilarious. Makes it sound like you're doing drugs, but they compared crack years. Or just, I don't know. I think that's, for some reason I chuckled when I read that. So they compare the crack years, and there was no significant association between crack years and arthritis. So that just means you can crack your little heart out, essentially. I think some people, my philosophy is that some people are probably born, or they have more joint space due to different reasons. And some of it could be like where you live and what you're eating, because like there's already more inflammation in certain foods, things like that. But it's like the crackers just end up with more joint space because of the crack. The other people already have more joint space. So neither is right or better, but that's why some people crack. Everything on me cracks, and it always has. So there's that. Now I understand better, at least. So this was the summary of the best research out there. So that goes to say that there isn't really that great of research, but this was the cream of the crop. So and the best.
All right. So when my back is really tight and feels sore and I crack it, I mean, is that, not trying to be funny about, is this sort of like when you're bloated and you can burp or something? Is that kind of the relief that I'm getting? Because
that's funny.
Seems like it's the same thing, and I'll use burping as the analogy. But you know, like the back can be like, it can be in pain, and as soon as you crack, you get the same relief as like if you sneeze, or again, like something like that.
Yeah, so I think the discomfort is coming from that lack of joint space, like in that. So back to this picture. So for us crackers, like this picture, say this was your back, which the joints are shaped completely differently. This picture is where you would start to feel discomfort. Then after you crack your back, you end up with space like this. So now where there was a kind of more pressure on the structures, now they have more space. So it's giving it more freedom. So if you will, you burped between the joints, maybe.
The old joint burp. I got it. Okay.
That's funny. Let's call it that from now on.
Yeah.
Every time you get up too quick and you got a couple burps in.
Yeah. So, and there's been like a lot of people that have said like, oh, you need more stability if you can crack your joints. But it really, that's not shown anywhere. And all of the things I saw were saying when you get to that point of cracking, you're not getting to a point of ligamentous injury like at all. Because some people have said if you do it so much, you're going to really overstretch, and then you end up with like these loose ligaments, and there's like no proof of that whatsoever. So, because you don't have to go that far. I mean, I suppose if you just went past it and held it there for a while, maybe, but that's not what's happening. So yeah. And here are my resources. I know you guys want to see that. Does anyone have any other questions on our joint burps?
I love that, 1971. I do have a quick question.
Yes.
I don't know your opinion of like chiropractors to begin with, but did it change at all with all of these studies, like with all the cracking and stuff?
So this actually just kind of goes along with my previous opinion, which is not a negative one necessarily, but it's my opinion is that they have their place, but it's a temporary solution. I feel like, so and I've always known from myself and from what I've learned that getting a crack or a cavitation causes the muscle guarding to go away. I've like seen it literally seconds after on people. And so many people, one of the main causes of their pain is muscle guarding, that like tense muscles and the knots and all that. And so if we can get that to release, they're going to not have pain. They're probably not going to have pain for days. But at the end of the day, we're not addressing why that muscle is guarding, or they're not addressing why that muscle is guarding. So it's just going to, if there's some sort of underlying issue or underlying lack of stability or something like that, if that's not addressed, then it's just going to come back. So I think that's my bone to pick, is that it's almost like a lifelong sign up a lot of times, because the cause is not being addressed, just the symptoms.
Gotcha.
But I'm sure someone that was a chiropractor would argue with me.
No, that makes sense. The first chiropractor I went to would just do the corrections and it was like, okay, but it kind of like felt like more like getting my hair cut. Like it worked for a little while and then I need to go back. But the most recent chiropractor that I went to did that. But then also it turns out like my hips weren't aligned right. So I ended up having to like put like a shoe wedge in or something just to like help one heel up. And that is when together it started helping out more.
When was that?
Does that make sense? That's for a different, I actually have my own town hall starting in 2 weeks and we can go over that.
I was gonna say that was
If you're
pre
interested.
us meeting because you've not had a
Please
heel
sign
lift
up
to my
then if
knowledge.
you'd like.
So you're chock full of excellent metaphors today.
Thank you.
You're very
Thank
welcome.
you.
Sean, I know that you're working, but do you have any questions or are you too, I don't know.
No question. I do feel a little bit better about having to crack all these joints.
Yeah,
Yeah.
Yeah.
too.
Thought it was a
I mean,
sign of like age or I don't know, something.
That I was like messing myself up every time.
Yeah.
Yeah. I mean, and some of the studies did say like you may end up with bigger joints, but it's not arthritis. It doesn't need to be painful. I mean, I do think at the end of the day, it's always better to have more stability. So like keeping the muscle strong around the joints, but I know you guys are doing that. So it's not like, but yeah, no, there's no like, that's it. So Tammy, you are our new guest for the day. So I don't know if you want, I do these monthly, and since you're here, you get to request next month's topic if you would like to. I have some suggestions for you if you want me to suggest. I'm just kidding.
Please suggest.
No, I don't need to. No, I was just kidding. I was just going to suggest what I know, some of the stuff you've dealt with, but you have a request.
Well, I'm still dealing with everything that you know about.
Okay.
So I'm
should we
about ready to come back?
Okay. Should we do posterior tib tendonitis then?
Sure.
Okay. A lot of people have that. Yeah. Okay. Well, a lot of people suffer from that. So I think it's a good topic and we haven't done anything like that.
I mean, I think I still
Okay.
have tendonitis in my hand, so I'm in.
Well, posterior tibs in your foot, but it's all right.
Yeah, that's why I said anterior tendonitis. Yeah.
Got it.
Yeah. 2-part town hall. Okay.
We
We've
will work on that.
graduated from metaphors,
Yeah.
working with wordplay.
Okay, guys. Well, thanks for stopping.